The malls are bustling with activity. The schools have reopened and flights are touching down in rapid succession in Dubai. The city is back where it belongs, on the world stage. And with all eyes on Expo 2020 Dubai, the transition to normality is complete. How did Dubai beat COVID-19? Like other parts of the world, Dubai too grappled with the coronavirus. But an entire community worked together to fight the virus and then ensure that it was safe for the people to get back to offices, schools, parks, and restaurants. It was not easy. There were sacrifices to be made. But when the people stood together as one, there was no turning back. This is the story of hope in the midst of adversity, the journey of a city that is back on its feet after spiritedly fighting COVID-19. The story of Dubai reopening after the pandemic is one of grit and determination, courage and fortitude. What looked like an insurmountable task around the world was made possible in Dubai by strategic planning and foresight. Everyone is responsible in the fight against COVID, and today, because of the direction of the leaders, the hard work of thousands of people who toiled on the front lines and behind the scenes, and the discipline of residents in following COVID protocols, the worst is behind us. Dubai Police was an integral part of the operation to tackle the pandemic. Whether it was implementing orders by the government or enforcing precautionary measures, or even observing restrictions on movement, Dubai Police did it all with patience and professionalism. The police initiated several programs where public participation was crucial in an effort to engage residents and spread awareness.
فهناك الصراحه كانت جمله من الاجراءات او من المهام او من العمليات الموقعه على عاتق شرطه دبي، لكن اكد لك ان شرطه دبي ما كانت تعمل بوحدها، كانت تعمل ضمن فريق عمل واحد مع جميع الدوائر الحكوميه الموجوده في اماره دبي. هناك يمكن لقينا في بعض الدول الاخرى مثل ما كنا نعرف من بعض القيادات اللي كنا نتواصل وياهم بخصوص جائحه كورونا والاجراءات الموجوده والتحديات الموجوده عندهم. يمكن خلال فتره كورونا يعني القياده العامه لشرطه دبي كان لها بعض ورش العمل مع بعض القيادات الموجوده على مستوى الدوله، كنا على مستوى العالم يعني من ضمن شرطه نيويورك او الشرطه الايطاليه والفرنسيه، فكنا نشوف شو التحديات الموجوده عندهم مقارنه بالتحديات الموجوده عندنا، وكان طبعا هذا من افضل الممارسات اللي كانت موجوده في هذاك الوقت. يعني طبعا شرطه دبي يقع على عاتقها التنفيذ، وهي تعتبر كسلطه تنفيذيه وتقوم بمجموعه من الاجراءات الموجوده يعني في المتعلقه بجائحه كورونا. اليوم اذا نتكلم عن مدى تطبيق الاجراءات الاحترازيه سواء كان الالتزام بلبس الكمام او التباعد الاجتماعي او في ساعات اللي هي الاغلاق التام اللي كان او الاغلاق الجزئي اللي كان موجود، وبالعكس اللي هو الفتح الجزئي او الفتح الكامل. للامانه يمكن القياده العامه لشرطه دبي وبالعمل مع جميع الشركاء الموجودين عندنا هني تم تشكيل مجموعه من اللجان. يمكن بذكر لك من اهم اللجان اللي تم تشكيلها هي اللجنه اللي كانت معنيه بالقطاع خلينا نقول السياحي. طبعا كانت في لجنه تجتمع بشكل يومي مع جميع مدراء مراكز التسوق الموجودين في اماره دبي، يمكن الرقم كان 30 او 32 مسؤول يجتمعون بشكل يومي. كانت تتم مراجعه عمليه تطبيق الاجراءات الاحترازيه والتحديات الموجوده عندهم في نفس الوقت يعني.
At the heart of operations to battle the coronavirus was Dubai's COVID-19 Command and Control Center. The nerve center of Dubai's response brought together all government departments, which made coordination faster and easier. The center's success stemmed from the structures and systems put in place for every aspect of the fight against COVID.
The Dubai COVID-19 Command and Control Center was established through a decree by His Highness Sheikh Hamdan Ibn Hamad bin Rashid Al Maktoum, the Crown Prince of Dubai, the chairperson of the Executive Council. The Command and Control Center was responsible for unifying the efforts in the Emirate of Dubai in managing the pandemic. And by unifying the efforts, it's a whole of government approach. It's mainly around bringing the public and private sector together in the healthcare arena, setting the policies and procedures for all activities across the city that would contain the pandemic, and make sure that we have enough capacity in terms of healthcare to manage the functions, and make sure that there are these are informed by science and by data, and also to keep the public informed with our the dynamic changes of the situation. The other role we had was to align our policies and our plans with the National Authority for Crisis Management and Emergency Management, NCEMA, and the Ministry of Health and Prevention. So the day-to-day activities was to mainly manage the Emirate of Dubai and also make sure that we're aligned with the national efforts across the system.
The Roads and Transport Authority was quick to formulate strategies to fight the spread of COVID in Dubai. The entire fleet of trains, trams, buses and taxis, along with the stations, were disinfected every day, and transport frontline employees were screened regularly. Passenger capacity was reduced to ensure social distancing, and the use of masks was made mandatory. RTA also used artificial intelligence technologies such as computer vision and machine learning algorithms to detect and report violations of COVID-19 preventive measures.
Various measures were adopted focusing on four main elements. The first one is protecting the health of all employees, ensuring also the safety of the public through the sanitization of all the facility and transport modes. The third one is ensuring continuity of our services and also supporting the Dubai government efforts in tackling the outbreak of COVID-19. We sanitized our fleet and facility daily. In addition to the sanitization of various public transport modes, the following measures were introduced also on resuming the services. The capacity on board for the public transport modes, including the metro, trams and buses and marine transport, was reduced to enforce social distances between riders.
Dubai's hospitals were on the front lines of the fight against the pandemic. While doctors and nursing staff treated infected patients with care, the general public were reassured that should the eventuality of hospitalization arise, there was nothing to fear.
It's very difficult to talk about a DHA strategy when it comes to COVID-19. It really is a national strategy. So it's a UAE strategy and a Dubai strategy, because it required alignment and support and coordination by everybody. With that coordinated approach, I think the strategy was also dynamic with different phases of the pandemic. So the basic principles, the basic public health and epidemiologic principles of social distancing, of face covers and masks, of containing people who are infected or contacts of people who have the disease, so with quarantine and isolation. These have been sort of the basic pillars of controlling the pandemic. And then for those who are unfortunate enough to get the disease, really making sure that the health system is ready to treat them and to help them recover.
During the pandemic, key messages had to be delivered to people of 200 nationalities in the Emirate, quickly and accurately. That's where the Government of Dubai Media Office stepped in. Teamwork, message alignment, and joint effort through task forces helped the office do its job to perfection. People were the core of communication, and a range of tools were deployed to send the message across.
Well, in any crisis, the media plays a very important role to unite everyone towards clarity and healing and recovery. And the key: speed, accuracy, credibility, and transparency. The communication team was committed to pave the way on this bumpy ride. We knew that the government communication and the media teams had to write the story from scratch. And on top of that, they had to make sure that this story reached everyone. And when I say everyone, I am referring to more than 200 nationalities that exist and live here in the UAE. When you have such diversity, you need to think outside the box. Yes, the official and traditional communication channels remained the backbone, but this was a human problem. It affected human lives drastically. We had to reach families, homes, businesses, labor communities, schools, and beyond. So we started innovating in our tools. The world as we knew it is rapidly changing, and our teams worked harder than ever to tell the right story. We tapped into every channel possible: social media, billboards, creative films, funny videos, virtual activations, you name it. And throughout this long process, we had engaged multiple communities: the media, the government, the business industry, the influencers, and anyone who wished to join us during this important time.
I was part of the media cell formed by the National Emergency Crisis and Disasters Management Authority, NCEMA, and we worked together to ensure every announcement and message was consistent with the broader national strategic framework to fight the pandemic. Ultimately, all our work was aimed at serving the best interest of the nation in this time of crisis. It was our responsibility to communicate vital messages to the community and raise public awareness on key issues and precautionary guidelines.
The Dubai Executive Council played a major role in ensuring that government departments continued working despite the disruptions around. Dubai government staff became a model for implementing COVID safety protocols. And when things began looking up, employees returned to work, wearing masks, maintaining physical distancing, and following other COVID-related restrictions. Slowing the spread of the virus was one thing, creating a strategy to reopen the city was another. The Executive Council not only planned the gradual reopening of Dubai, but also ensured that both the social and economic life were protected.
When the crisis hit us, we had to mobilize a full team that will be responsible to respond to this crisis. And one of the first things we've done was to establish the Command and Control Center. In the early stages of the Command and Control Center, we had to put our strategy and our action plan together. And we definitely looked at best practices, we looked at benchmarks, we looked at how countries and cities started reacting to the pandemic, because by its nature it was new and unique. And in Dubai, we also were lucky enough to bring in the public and private sector and subject matter experts locally who helped us to shape that strategy. So we did customize our own strategy that was based on 4 stages. The first stage was basically slowing the spread of the virus. The second stage of it was basically a gradual reopening. And then from there, our third stage was basically as part of our safeguarding and protecting and lifting the restrictions, be it the social life, the economic life, and eventually leading to the fourth stage, which is the full recovery, or basically building our readiness for the coming era, which is the new normal.
When the coronavirus hit, schools were closed and children stayed home, but teaching continued online. Teachers and students quickly switched to the new mode of learning via computers, tablets, and phones. Over time, attention shifted to when and how schools would reopen, a task that required considerable preparation. Children were first given the option of choosing whether they wanted to go back to face-to-face learning or continue studying from home. In the end, it was a learning experience for everyone.
I think it didn't really register till when we are talking about, hang on, we need to shift the spring break 2 weeks ahead, and so we can have time to prepare for technology and distance learning and figure this, and maybe it's might be all over with by that time, but let's move the spring break. And we accepted those decisions because I think for most of the time we were dealing with something we did not know and nobody knew, and so any decision about closing something or shifting something was fine. It was not easily accepted, but we had nothing else. We couldn't do anything else because we did not know what people were dealing with. People felt comfortable. Okay, maybe now we start opening after Al-Eid. I remember protocols were designed in a way for different segments, and we felt better because now we are moving toward not closing, but toward opening more. One of the big milestones that we have worked together with various entities on the government, whether state or federal, in that time, right after Al-Eid, I think in end of May, beginning of June, and we were really keying about the message has to be clear. September, there is a schooling.
To ensure that nothing was left to chance and that every crucial decision-making aspect was linked to international developments, a treatment protocol task force was formed. A field hospital was set up at the World Trade Center with 3,000 beds, complete with oxygen supply for critical patients at the ICU level. Ventilators were sourced from across the world, and healthcare professionals were trained to work outside their areas of speciality.
There are national guidelines for the management of COVID that's been brought out by Abu Dhabi in cooperation with all the health regulatory bodies in the UAE. With the rapid development occurring in COVID management, we've decided to form a treatment protocol task force in Dubai that is headed by MBRU, the Mohammed bin Rashid University, and has representation from DHA and the private sector. And their remit is to go through the most recent literature and get the latest evidence for treatment of COVID. And what we do is we utilize an inspection team that we formed during the first surge of COVID. And this team visits the hospitals, both government and private, to ensure that patients are being treated within the right category.
Thousands of doctors, nurses, paramedics, and staff work tirelessly in Dubai's hospitals and clinics to save precious lives during the pandemic. Local and expatriate staff in public and private hospitals worked 12 to 14-hour shifts, some living alone in hotels near hospitals, unable to go home for months. Dubai's Rashid Hospital was in the forefront of the battle against COVID. More doctors and nurses were hired, the number of intensive care beds was increased, and specialized medical equipment was acquired to tackle the pandemic head-on. Three core principles helped nurses cope with the pandemic: adapt to changes quickly, be healthy, and care is the core of nursing.
So, since the beginning of this pandemic, the emergency medicine team, along with Rashid Hospital Administration at Dubai Health Authority, have come up with lots of initiatives to address this matter. We developed new working procedures on how to deal with the confirmed cases and the non-confirmed cases from the beginning of their medical journey. And that also created a high pressure on us. The administration, with their wise judgment, have made earlier collaborations between all the hospitals, all the primary healthcare centers, all the quarantine centers, all the quarantine hotels, and also there is a command center. So this collaboration, discussion between them, which center to take which type of cases, had made the pressure less on us.
All throughout this course of pandemic, I think the best things that a nurse should have, or should I say, I will share my personal formula in being a nurse and in dealing with patients are my ABCs. A is to adapt to changes. If you learn to adapt to the changes in the environment, you will develop the changes also into yourself as to rendering a good patient care and also avoid negativities and to provide yourself a focused, more optimistic side. Also, be healthy. See care as your core. Synonymous to being a nurse is care. We love life and we fight for patients' lives too.
The most important thing in this case, to educate ourselves how to take the proper precautions, how to protect ourselves as the first line, then we can deliver the services to the patients safely and in a high quality standard. What was our preparedness plan? It was about developing and initiating multiple task force related to the workflow management, related to the services delivered to the patients, the quality of health of our staffs as well as frontliner. By creating these task force, we have run out from this pandemic successfully.
Reverse transcription polymerase chain reaction, popularly called the RT-PCR test, was one of the most crucial factors in containing the transmission of COVID-19 in Dubai. The efficiency of this test and the team that worked behind this helped frontline workers quickly identify COVID-positive cases and provide immediate medical facilities.
Reflecting back on the experience we had with our testing work stream, one of the first important milestones we had was recruitment of the team that would work around ramping up the capacity. We looked at ramping the capacity, number of tests, and also as important, the turnaround time, that is from the collection of the swab till the reporting of the test result. Obviously, there's a lot of processes within, and we wanted to make sure that we are achieving our goal by providing ease access, safe, quality testing for our community. While we were building this framework, there was also parallel to that building up the quality standards for testing for the Emirate of Dubai to make sure that any laboratory or any hospital, any clinic that was providing the service was following the right standards, and we can compare results very comfortably between different providers.
Fearless and determined to honor their medical oath were staff at the Dubai Corporation for Ambulance Services, who saw it as an opportunity to serve the country. First responders reached out to cries for help, and paramedics rushed to make critical decisions. They were times that tested the resolve of the best.
يعني جهزنا تقريبا 122 نقطة إسعافية متواجدة في إمارة دبي، بالإضافة إلى 24 إسعاف متخصص لنقل المرضى في بداية كورونا. ركزنا على مبادرة سميناها فحصك علينا. تم هذه السيارة تنتقل إلى البيوت لفحص كبار أصحاب الهمم، كذلك كبار المواطنين، على أساس أن الواحد لما يعني ينتقل عندهم نعمل فحوصات كورونا في المنازلهم. أثبتت مؤسسة دبي الخدمات الإسعاف خلال جائحة كورونا قدرتها وكفاءة كوادرها على التعامل مع جميع الحالات بمختلف أنواعها.
أول شيء هذه خدمة إنسانية، والقيادة الرشيدة أعطتنا معنوية وزيادة. ونحن في المؤسسة أعطونا دورات، أعطونا ورش عمل كيف نتعامل مع فيروس كورونا وجميع الأمراض المعدية، ونحن جاهزين لكورونا والأمراض المعدية على مدار ال 24 ساعة حاضرين.
طبعاً كوني طبيبة وفي ظل هذه الجائحة أتذكر القسم الطبي، وهو أن أعاهد رب العالمين أن أخدم وأصون حياة الإنسان في جميع الأحوال والظروف، أنقذ الأرواح وتعامل مع المرض والقلق. فطبعاً مهنتي كطبيبة هاي مهنة إنسانية بالدرجة الأولى، وهذا رد بسيط وجميل لما قدمته الدولة لنا كخط دفاع الأول.
Emergency plans and quick response ensured the continued availability of water, electricity, and vital resources to Dubai's residents during difficult times. Dubai Electricity and Water Authority's advanced digital infrastructure greatly contributed to the continuity of its services, with teams of engineers and technicians placed at various locations across the emirate to handle emergencies.
وفي هيئة كهرباء مياه دبي تعاملنا مع فترة كوفيد-19 وفق ظروف كل مرحلة. بمجرد الإعلان عن انتشار فيروس كورونا المستجد كوفيد-19 وقبل تحوله إلى جائحة، فعلنا خطط استمرارية خدمات الكهرباء والمياه بمختلف سيناريوهاتها لضمان توفير هذه الموارد الاستراتيجية والحيوية لإمارة دبي. وبعد الإعلان عن تحول الوباء إلى جائحة، فعلنا خطط طوارئ واستمرارية الأعمال التي تم اختبارها عدة مرات من أجل ضمان انسيابية واستمرارية الأعمال، كما تم تفعيل فريق الطوارئ والأزمات لمتابعة فعالية الاستجابة والتنسيق مع شركاء الهيئة الاستراتيجيين على مستوى الإمارة والدولة، والتنسيق مع لجنة الكوارث والأزمات لإمارة دبي.
Vaccination campaign and strict measures at home helped the gradual reopening of tourist spots and hotels in Dubai. Parks, shopping malls, restaurants, and cinemas took precautionary measures to combat the spread of the coronavirus, but encouraged the people back. The Dubai Department of Tourism and Commerce Marketing also introduced a Dubai Assured Stamp, a compliance protocol that certifies establishments within the tourism ecosystem that adhere to health and safety protocols.
Looking specifically at the tourism sector shut down like any other back in April last year. The first thing that happened is we communicated with the industry in Dubai on a regular basis. We held online workshops every couple of weeks to make sure that both us and the industry could work together hand in hand on how to plan for the industry to come back. When it came to May, we decided it was time and the precaution measures were ready to reopen the tourism sector, albeit in May it was the domestic side. Then the plan began to open to international tourism. International tourism opened in July, and we found that the market began coming back.
We are lucky in Dubai that our tourists and residents and the people of Dubai do comply and follow the guidelines that we put together. There is a level of trust that we have seen between the people and the government, especially when it comes to their respect to the guidelines that we provision. We are logic and we take subject matter expert opinion, and we do make sure that whatever guidelines and provision we put in is acceptable and adoptable.
From inspections to disinfection drives to treating medical waste, the Dubai municipality had its hands full. Extraordinary times call for extraordinary measures, and Dubai municipality rose to the task. An army of workers backed by vehicles and drones moved in to spray disinfectants in public areas. And when businesses reopened and social activities resumed in a phased manner, the municipality ensured that the premises and the people conformed to COVID safety protocols.
في البداية بلدية دبي سخرت منذ بداية الجائحة كل إمكانياتها البشرية والمالية وجميع مواردها وتقنياتها الذكية بالتعاون مع جميع شركائنا في حكومة دبي بتنفيذ جميع الخطط والحملات الرقابية أو الحملات الكشف على جميع المناطق والتأكد من التقيد بالبروتوكولات اللي نزلت أو أن الحكومة نشرتها. بلدية دبي خلال هذه الفترة ومنذ بداية الجائحة قامت بتقريبا ما يزيد عن 637,000 حملة تفتيشية أو زيارة تفتيشية على مستوى إمارة دبي. ليومنا هذا وصلنا تقريبا إلى 1,000,000 زيارة تفتيشية. جميع هذه الزيارات لرصد الممارسات والسلوك والحالات التي لا تتوافق مع الإجراءات الاحترازية التي أقرتها حكومة دبي.
Swift and effective measures helped Dubai's economy rebound from the impact of COVID-19. Thousands of safety inspections helped manage the spread of the coronavirus since it was first reported. Once the immediate threat to public health was addressed, focus turned to the revival of businesses. Economic stimulus packages worth 7.1 billion dirhams were announced.
When the pandemic started spreading in the region, Dubai realized from the beginning how important to maintain the people's health issues as well as maintaining and keeping healthy businesses going on. Dubai economy worked closely with the Crisis Management Committee and the other government entities to set up the health prevention measures in business sectors, as well as enhancing and enforcing these measures on the ground. Dubai economy conducted more than 170,000 safety precaution inspection visits that helped to manage the spread of the COVID-19 virus. We also managed during these visits to control the wave of price hiking, which happened during the first wave of the virus, and stabilize it in a very short period of time.
Like elsewhere in the world, the fallout of the pandemic affected air travel to Dubai. But in the early days of the coronavirus, there were people waiting to go to their home countries and others hoping to come back. With international borders closed, the demand for air cargo increased as there was a need to transport essential goods. cargo freighters from Dubai World Central were moved to Dubai International to make it easier to move essential goods. Dubai has been considered one of the highest PPE moving cities around the world, transporting the essential kits to the Indian subcontinent, Africa, Asia, Europe, and the United States. The airport's cargo unit also had to contend with the spike in e-commerce demand. Air travel corridors were set up so flights could resume. In January, Dubai launched the Vaccine Logistics Alliance to speed up distribution of COVID-19 vaccines around the world through the emirate. Dubai Airport facilitated thousands of repatriation flights from April to July 2020.
In Q1, we had welcomed around 5.7 million passengers, and this is an encouraging number. All of this because of the efforts taken by the government, especially in opening up travel corridors with different countries. The early opening of Dubai to welcome tourism, had helped the airport to recover, quicker than anticipated. Dubai Airport was one of the airports which implemented I will say a complete testing facility. We created a vaccination center at the airport. We were able to administer vaccines to around 100,000 airport employees. So our intention was, to provide a safe environment at the airport, so the travelers can feel safe. Also, our employees can feel safe, and this was our direction.
Our staff are well trained, for such situations, such emergency. But the issue here was, having this number of people stuck and nowhere to go. Our main objective at that time is the welfare of the passengers and the staff. The other challenge is that we went in very short of resources, as all our outsourced suppliers were seized and stopped. We had to take care and look after the welfare of staff and make sure that we had the minimum infection rate of staff. Otherwise, our operation will go into complete halt. Similarly to the passengers as well. People get frustrated. Imagine you're locked down in a room for 45 days. So that emotional and psychological support was provided by the team, creating these close bonds with the passengers. The bigger challenge was, the measures that we applied over here, the social distancing, the spacing, our capacity was reduced to half. So these, just in a nutshell, these are the biggest challenges we face, how we managed all this.
The demand for air cargo increased suddenly. Because there was a need, obviously, to move essential items and all of that. So what we've done as Dubai Airports is basically try to resupply that traffic and move some of those cargo that used to be on passenger aircraft to fully dedicated cargo aircraft. That was one of the first things we've done. The second was to make it easier for businesses. We relocated some of those freighters from Dubai World Central to DXB, and makes it easier, allowing for a better connections of moving goods and essential items to a much needed destination.
As airlines scrambled in the wake of COVID-19, Dubai's Emirates Airline stayed ahead of the curve. It introduced measures on board to keep both cabin crew and passengers safe. Protective breathing equipment and sanitization kits gave an extra layer of cover and peace of mind during travel. On the ground, self-check-in and bag drop kiosks were introduced at Dubai International Airport. During the height of the pandemic, Emirates rose to the challenge of bringing back people who were stranded in other countries and repatriating thousands of travelers stuck in the UAE. The airline also helped transport tons of essential commodities over a year and played a key role in ensuring that vaccines were delivered on time. When global trade lines were interrupted, Emirates hit upon a plan to use some of its passenger flights to carry cargo. What started as a one-destination flight soon grew in number till almost 90 passenger flights began flying to about 120 destinations carrying cargo. Emirates Sky Cargo set up a dedicated airside hub in Dubai for distribution of COVID-19 vaccines and became the first airline cargo operator to ship more than 50 million doses of vaccines on its flight. In April, it was reported that 1 out of every 20 COVID vaccine doses administered around the world had transited through Dubai and had flown on an Emirates aircraft.
Emirates from the beginning was pioneer in trying to introduce changes and discuss with the relevant authority protocols to stimulate a business and to assure our passengers the confidence in travel. We were one of the early airlines who have introduced measures on board the aircraft in terms of hygiene, in terms of protective breathing equipment for our cabin crew, mask, and we were one of the company who provided sanitization kits to our passenger whenever they check in. We were one of the companies who have introduced insurance or provided an insurance covers for our passenger for COVID-19 whenever they travel in Emirates.
As Dubai was a pioneer and took the lead in reopening its airport to the world back in July, and as Emirates again built up its network gradually since then, we have seen the peak back in December, January, where the spike happened in the booking. Many people were in Dubai. Even from the tourist side, we have seen Dubai hitting almost 500,000 tourists in a month of December. Same thing happened in month of January. So 1 million people in terms of the visitor came in these 2 months. I think we have seen the worst, and what will come in will be more positive and more towards the opening.
Back in March, last year when the airline had suspended the operation, of course the suspension have come in almost like a sudden stop of all our operation, and therefore for us, it was absolutely essential seeing the cargo demand was continued to flow. It was a lot of essential commodity that needs to get to a lot of destination, be it food or medical equipment. We were sort of putting together the whole entire plan in terms of what is it that we need to do to sort of be able to start operating some of our passenger flights as cargo. The challenges that we were faced with is that a lot of the vaccine had to move in very much sub-zero sort of temperature to be able to move it from one destination to other. With that kind of sort of complexity, it was absolutely essential for us to sort of really understand what would it take to ensure that we move these essential commodity like the vaccine, which is so important. It needs to move safely. It needs to reach the final destination on time. We've immediately embarked on a solution of creating almost our DWC facility. We've activated that, and we've created a hub for the vaccine in Dubai.
At the General Directorate of Residency and Foreigners Affairs in Dubai, work never stopped. As international borders closed and people were forced to stay indoors, the nodal authority for expat and citizens' travel issues sprang into action. A remote working system was put in place early, thanks mainly due to preparations for emergency situations like this that began many years ago. Passport control officers were among the first to begin using masks, and protective measures were taken at the airport. Staffing at Amer call centers was strengthened to answer queries round the clock.
واقعة كورونا على المجتمع وعلى الدوائر والمؤسسات العاملة والشركات حقيقة نحن في الإدارة العامة للإقامة وشؤون الأجانب لم نتعامل مع كورونا ككورونا، تعاملنا مع كورونا كمشكلة من المشكلات والتحديات التي تواجه المجتمع. كانت عندنا قضية رئيسية هي تجديد الإقامات. نحن اوريدي تجديد الإقامات عندنا عن بعد، وهذا كان إجراء استباقي من قبل كورونا. فلما جانا كورونا نحن ما تغير علينا شيء، الشركات موجودة وتقدم عن بعد طلباتها. نحن مركز الاتصال عندنا تقريبا اللي يداومون على مدار الساعة 30 موظف، طورنا المركز وحولناه إلى 100 موظف على مدار الساعة. مركز الاتصال حولناه كل شخص في أي مكان موجود فيه، سواء في بيته سواء.
عملنا كان الإدارة والمسؤولين كونوا فريق متميز بنظام مناوبات للعمل الحد من الجائحة وخدمة المسافرين في نفس الوقت. وضعنا خطة استراتيجية لضمان انسيابية الحركة في المطار رغم من الجائحة. استمرينا بنفس خدمة المسافرين مع اتخاذ الإجراءات الوقائية. أنا طبيعة عملي أني أكون متواجد في منطقة خدمة الجوازات لاستقبال المسافرين وإكمال إجراءاتهم. برغم الجائحة وصعوباتها كنا نستقبل المسافرين بابتسامة ونطمنهم أن الأوضاع طيبة وأن الأمور وأن دبي ترحب بكم ونهديهم. برغم كل هذه الظروف والتحديات كنا نستقبلهم بابتسامة.
Street patrol officers faced novel challenges, but Dubai police managed to maintain a balance between the usual responsibilities and protecting the health of residents. There was the constant risk of contracting an infection, but this did not keep officers from doing their job. Police patrolled the roads, at the borders and in markets. Drones were used and thermal helmets were worn by officers to monitor the temperature of people using public transport.
طبعا شرطة دبي الجهة الحكومية رئيسية في تصدي لجائحة كورونا، وكانت لها دور كبير في التنسيق مع الشركاء الخارجيين من جميع الدوائر الحكومية في إمارة دبي. ونحن في شرطة دبي لزم علينا وكان واجب إنادي أن احنا نتواجد في الوقت اللي كانت فيه إغلاقات على مستوى إمارة دبي أو على مستوى العالم ومستوى دولة الإمارات وإمارة دبي. صار اللوك داون إغلاق بشكل كامل، تحميم ممتلكاتهم. كانت عندنا دوريات مسيرة على الطرقات، نقاط تفتيش على المناطق الحدودية في مداخل ومخارج إمارة دبي، نقاط تفتيش داخلية، عندنا دوريات راجلة وحراسات في الأسواق الشعبية.
The knife area faced a unique challenge, one that warranted a unique response. When there were reports of several cases of COVID-19 in the area, restrictions were imposed. The police embarked on a mission to reassure the residents in the area, send the affected for treatment, and ensure that food and essential supplies kept flowing in. When the restrictions were lifted after 28 days, there were celebrations.
Thank you, sir. Thank you.
طبعا التحدي كانت المعلومات ترد علينا بشكل كبير فيما يخص انتشار الوباء في منطقة نايف والراس. في ذاك الوقت طبعا كان لابد من التدخل السريع عشان نحن نحتوي هذا المرض من الانتشار. تمكنا طبعا فريق من دراسة الوضع ووضع الأرقام على أرض الواقع، الإحصائيات اللي كانت موجودة، وطبعا اتخذ قرار في إغلاق المنطقة بالكامل على أساس احتواء الفيروس. فترة الإغلاق كانت تقريبا أقل عن شهر، 28 يوم. طبعا في بداية الأسبوعين الأول كانت حالات النقل، حالات الإصابات اللي كانت موجودة في المنطقة كانت في ازدياد لغاية ما وصلنا في الأسبوع الثاني تقريبا كانت ذروتها. وبعدين تمينا نراقب المؤشر، الحمد لله رب العالمين الحالات الإصابات كانت تنقل بشكل أقل حين ما وصلنا آخر 3 أيام قبل فتح المنطقة كانت حالات 0 3 أيام وراء بعض.
Dubai's firefighters and civil defense personnel found that their state of high alert was an advantage during the pandemic. Trained to deal with fires and accidents every day, the civil defense team responded immediately with courage and determination. In the early days of the coronavirus infection, fire engines were modified to disinfect the city. Awareness was raised among workers and personnel worked round the clock to bring life back to normal.
خلال جائحة كوفيد-19 أثبتت دولتنا قدراتها على احتواء الجائحة بفضل رؤية ودعم ومتابعة قيادتنا الرشيدة لجهود خط دفاعنا الأول. فإن فرق الدفاع المدني بدبي أنجزت خلال جائحة كوفيد-19 تعقيم أكثر من 90% من مناطق دبي بالتعاون مع الشركاء، وتأمين المستشفيات الميدانية وخيم الفحص الخاصة بوباء كورونا، وتنفيذ حملة توعية للوقاية من الجائحة من قبل فرق الدفاع المدني الوقائية في مواقع سكن العمال التي استفاد منها 170 ألف عاملا في 490 سكنا للعمال.
Between March and June 2020, Dubai government departments began working from outside the office as part of measures to prevent the spread of COVID-19. The remote work plan was made possible by the sophisticated telecommunication infrastructure in the city and was a resounding success.
حقيقة دور دائرة الموارد البشرية خلال الجائحة كان دور محوري، وخلال الجائحة احتاجت هذه الدوائر أن تكون على بينة من حيث الإجراءات الاحترازية اللي لازم توفرها للحفاظ على الصحة والسلامة الخاصة بالموظفين والحماية من انتشار كوفيد-19. ولله الحمد حكومة دبي كانت جاهزة لمثل هذا التحدي. الانفراستراكشر والبنية الأساسية التي كونتها خلال العقود الماضية في الأنظمة الإلكترونية المختلفة التي تساعد الموظف على أداء عمله كانت جاهزة أن تقدم الخدمة لهذا الموظف وأن يقوم بالعمل من خلال المنزل. وجدنا اليوم الاجتماعات عن بعد، وجدنا اليوم إنجاز المعاملات عن بعد، حتى المتعامل لم يتغير عليه الشيء الكثير. وصلنا إلى تقريبا أكثر من 87% من الخدمات كانت تعمل بشكل طبيعي.
For an emirate depending on imports for more than 90% of its food supplies, COVID-19 could have posed a major threat to food security. But Dubai turned adversity into opportunity. Food imports were increased in 2020, ensuring there was no shortage in the city and people did not have to resort to panic buying. The Dubai Food Security Committee developed emergency management plans and reached out to the community to improve knowledge around food security. The strategy and proactive measures helped Dubai coast through the pandemic and ensured that supermarket shelves remained stacked and there was sufficient food to go around.
Dubai government during the pandemic, they established a team at the level of Dubai government, and this team it was from all entities, governmental entities and the private sectors in Dubai. From Dubai Municipality, Dubai Customs, Dubai Police, from the Ministry of Economic, and even from the private sectors, they cooperate with us in this team. And this team started to evaluate the amount of the food that been produced internally in UAE and Dubai especially, and also the importation, the quantity of imported food. So we started to evaluate the quantity, and we were monitoring the amount of the food that comes to Dubai, and even from the country of source. We started to communicate with the country of the source and to see the amount of the food that going to be produced and sent to Dubai. At the same time, we started to see the alternative solutions, especially Dubai is depending on the imported food. So we selected 23 food items to be as the main food item and to make sure that these food items are available in Dubai.
outdoor sport and games were a casualty of COVID-19, but it allowed the Dubai Sports Council to rise to the challenge and think afresh. One of the solutions was to create more activities for the community online, like the Be Fit, Be Safe initiative. Some could be done at home and some on a bike. Although a few events had to be postponed, the sporting scene sprang back into action soon. What followed was a series of international events, including the 2-month-long Indian Premier League cricket.
The government is give us a space to make solution. And what is the solution? The solution is coming to make more activity for the community in a virtual system, which most of them, they are very happy to be start active again in-house or in their community. We come with a proposal, which is a program called it Be Fit and Be Safe, which this program is work worldwide, and everyone was very happy with it. So we keep the community and all of them busy with that. We react according of what we have in our hand and can be work and can be safe. We make different program for all of them, and everyone was satisfied with that. We have a lot of activity. We are not locked down completely our activity.
We organized a beach festival with different games, keeping in mind no spectators. Highest precautions were taken to ensure the safety of all the players. And we also organized snow run, which was one of its kind, snow run in the middle of desert. We ended the year with the most prestigious conference and the award, which is Dubai International Sports Conference. The first country and a city to organize a physical prestigious conference. So big names, big stars, decision makers were all in one place.
When a healthcare facility for women and children opened its doors to men for the first time in its history, questions were not asked. Rather, staff at Latifa Hospital ensured that COVID-19 cases were managed well and patients were sent on the road to recovery.
Most of the staff here in Latifa Hospital are women, more than 85%. Obviously, because we have women, we cater for women and children. So the majority of staff are actually female. For the first time, actually, in the history of Latifa Hospital, we started taking men to our hospital because they needed bed. We took care of them. I have an amazing team who was willing to do whatever it needed to take care of patients, men, women, or children.
When it comes to vaccinations, the UAE is head and shoulders above most other countries. The Dubai Health Authority achieved this by training healthcare workers and by using a proactive multi-pronged strategy. With several vaccination centers open, people were able to access the one nearest to their home. Home vaccination services were available for people of determination, Emiratis above 50 years, and expatriates above the age of 60.
As we all know, we have started a vaccination campaign in Dubai Health Authority and Dubai Emirates, and it was last week of December, 23rd of December 2020. And we had several phases for the vaccination. It's very important to understand how the vaccination committee works. Now we have many teams under the vaccination committee, and we have the scientific team which takes care of all the scientific issues related to the vaccination. So we are keeping ourselves updated with the latest studies, practices, data, which comes out from the international bodies that are responsible to issue all the updates about the vaccination. And based on these studies and researches, and based on our scientific team feedback, we take our decisions in the vaccination.
More than a year after COVID struck, Dubai is looking forward today to Expo 2020 and to the future that lies ahead. Indeed, the best is yet to come. People have started traveling again, the restaurants are full and the malls are bustling. Children run around in parks and have started going back to school. The smile has returned to the faces of the people. By being responsible, the community has played a big role in Dubai's return to normality. There were hurdles that were crossed to get here, challenges that were squarely met, but conquer it did. Together, as one city, as one people, the spirit of Dubai has won.